For ventilator-dependent patients, oral care is critical care. Proper oral care is the first line of defense against ventilator-associated pneumonia, or VAP, which accounts for up to 60% of all deaths due to healthcare-associated infections, or HAIs. Approximately 86% of hospital-associated pneumonia is linked with mechanical ventilation. With statistics like these, you can see that it's worth taking whatever measures you can to prevent even one case of VAP. The Centers for Disease Control recommends an oral hygiene program for patients at risk for VAP. The American Association of Critical Care Nurses advises brushing patients' teeth twice a day, swabbing with HP solution and applying a mouth moisturizer every 2 to 4 hours, and frequently suctioning the oral cavity and pharynx. As part of Kimberly-Clark's major initiative to help fight healthcare-associated infections, we are proud to introduce our new KimVent 24-hour oral care kit. It's designed by nurses for nurses with all the tools you need to clean, suction, and moisturize in an easy-to-use modular toolkit. The 24-hour, every 4-hour kit features individual procedure packs that let you choose the right tool at the right time based on individual patient care needs. This video demonstrates the correct way to set up your KimVent 24-hour oral care kit and operate the cleansing and suctioning tools with the suction handle. The KimVent 24-hour oral care kit is designed to be kept at the patient's bedside. You can easily hang the carton on the wall or keep it on a flat surface such as a cabinet or shelf. The easy access carton with dividers creates a convenient container for storing additional patient care items as well as the components of the kit itself. Remember, the success of your oral hygiene program depends on proper protocol compliance, and that means utilization of a complete kit within each 24-hour period. Note that the individual no-mess procedure packs create their own portable workstation. To open them, you can hold them in your hand or place them on any flat surface. The portable no-mess solution cups contain ample fluid and can be used right in the procedure pack or on any flat surface. To set up your Kimberly-Clark KimVent 24-hour oral care kit, you'll need a canister and enough tubing for a dedicated oral care line. Open the kit by tearing off the top portion of the box and discarding it. Next, select the KimVent Prep Pack from the kit and open the package. If you're using a single suction canister for closed suctioning and oral care, attach the provided Y adapter to the suction port. Then attach the oral care suction tube to one Y adapter port and the closed suction tube to the other port. It's important to note that both ports on the Y connector must be used or loss of suction strength will occur. Next, attach the yank hour to the suction handle. To store the yank hour, clip the handle to the top of the suction tubing in an upright position so that it's out of the way but within easy reach in case of an emergency. Most of the tools in the KimVent 24-hour oral care kit are designed for single use. The only exceptions are the covered yank hour and the ergonomic suction handle, which are intended for use over a 24-hour period. The ergonomic suction handle features a soft on-off suction control switch for increased comfort. Be sure the suction control switch is turned off when not in use. The covered yank hour helps remove oral debris and secretions. It features an innovative self-cleaning mechanism that utilizes Kimberly-Clark's proprietary PEEP Seal technology to help remove potentially infectious secretions and debris from the shaft after suctioning. Our covered yank hour remains drier and cleaner between uses. The cover also protects the KimVent yank hour between uses. To use the yank hour, slide the cleaning sleeve toward the handle. To apply suction, slide the switch to on. While you suction and clean the oral cavity, the yank hour's rigid, clear, curved shaft allows for increased visibility and maneuverability. Its high-flow, atraumatic tip with multiple holes quickly and effectively removes tenacious secretions. After suctioning, advance the cleaning sleeve toward the tip to clean and dry the yank hour. With the suction still on, immerse the yank hour tip in sterile water or appropriate solution until secretions clear. When finished, slide the suction switch to off. The yank hour should remain attached to the suction handle whenever the KimVent 24-hour oral care kit is not in use, but in ready reach for emergencies. Storing the yank hour on a suction hose in the upright position eliminates storage of the device under pillows, on tables, or in other areas of potential contamination. To disconnect the covered yank hour and all other tools you'll be using, pull the tool off the handle. The suction toothbrushes remove dental plaque, debris, and secretions. Our toothbrushes have soft, gentle bristles that won't come out. Select the KimVent suction toothbrush and attach the toothbrush to the handle. Peel back the dispenser lid and moisten the toothbrush. To suction, slide the switch to on and clean the teeth and tongue according to your hospital protocol. Then slide the switch to off. Disconnect and discard the toothbrush. Reattach the yank hour to the handle and clip it to the suction tubing for storage. The KimVent 24-hour oral care kit suction swabs have an angled tip design that provides easy access to buccal surfaces to help remove oral debris and secretions. And the soft sponge tip stimulates, cleans, and freshens oral mucosa. To use the suction swabs, first remove the yank hour from the handle and set it aside, and attach the suction swab to the handle. Peel back the solution dispenser lid and moisten the swab. To suction, slide the switch to on and clean the oral cavity. When finished, slide the switch to off and disconnect and discard the suction swab. Reattach the yank hour to the handle and clip it to the suction tubing. The KimVent 24-hour oral care kit's mouth moisturizer contains aloe vera gel to provide moisture to the patient's mouth and lips. To use it, remove the applicator swab from the package and coat it with the mouth moisturizer. Apply the moisturizer to the patient's lips and mouth. Upon completion, discard the applicator swab after use. The KimVent 24-hour oral care kit's oropharyngeal suction catheters help remove oral secretions above the vocal cords. To use the oropharyngeal suction catheter, first remove the covered yank hour from the handle and set it aside. Attach a suction catheter to the handle. To suction, slide the switch to on and suction and clean the oropharyngeal cavity. When finished, slide the switch to off and disconnect and discard the suction catheter. Again, reattach the yank hour to the handle and clip it to the suction tubing. Our KimVent 24-hour oral care kit can help make comprehensive oral care easier for you and more comfortable for your patients. Kimberly Clark KimVent 24-hour oral care kit for one less worry.